Okay. Okay. Uh, Big Bulavinaka from Fiji. Good evening, ladies and gentlemen, all across the Pacific and across the world. I'm Dr. Alipate, and I'll be introducing this webinar today. So the webinar is being recorded, and links to the recording will be emailed in the next 24 hours to those who have subscribed to our newsletter. And the South Pacific Society of Lifestyle Medicine, this is an organization that is dedicated to bringing together individuals and organizations to effectively combat this pandemic of non-communicable diseases that is sweeping across the South Pacific and indeed the world. SPSLM seeks to promote the education and training of health professionals in the use of evidence-based approaches to address the root causes of non-communicable diseases. So for those of you who are new to the arena of lifestyle medicine, it's basically, once again, the evidence-based practice which helps individuals and communities with comprehensive lifestyle change. And this includes things like nutrition, physical activity, stress, social support, environmental exposures, etc. And this is to help prevent, treat, and even reverse the progression of many types of chronic diseases. And it does this by addressing the underlying causes, which is obviously lifestyle. The SPSLM is having its inaugural conference, and this is from the 10th to the 12th of March 2020, and this is going to be held at the beautiful Pearl Resort on Pacific Harbor in Fiji. Along with this, we're going to have certification exams, and this is the International Board of Lifestyle Medicine. You can get certified by the IBLM and look at all the places around the world where this is happening. And in March 2020, at the end of the SPSLM conference, we will be doing the examinations in Fiji. Again, note that date in your calendars if this is something that you think you want to get certified in, and contact us at the SPSLM website, and we will have more details for you. In fact, we have a previous webinar that has been recorded which gives you all the details on the examination. So once again, the 13th of March at the Pearl Resort, just after the SPSLM inaugural conference, we will be having the exam. Now, with NCDs responsible for 70 to 80% of all healthcare expenditure, most health professionals still, unfortunately, treat these diseases the same way we do communicable diseases, and this is with pills and injections. Now, while this might temporarily relieve symptoms, it obviously does not address the underlying cause of disease, which is lifestyle. And most physicians and health professionals have little or very little training in lifestyle medicine, things on nutrition, exercise, rest, and these are the pillars of lifestyle medicine. So learning how to prevent, arrest, and reverse chronic disease in a scientific, evidence-based manner, and you receive the official seal of approval internationally. That's one of the benefits of signing up and completing the International Board of Lifestyle Medicine examination. So once again, it'll be held on Friday, the 13th of March, 2020, just after the conference at the Pearl. So to prepare for the exams, we recommend completing the Lifestyle Medicine Board Review course. And once again, if you want to learn how to enroll into this course, to sit the exam, you can send us an email at info@spslm.org. That's the website or the email address that you can send an email expressing your interest to join us. So today I have the pleasure of introducing Dr. Margaret Cornelius. She is no stranger to those of us here in Fiji. She's worked for the Ministry of Health for 34 years, and specifically in the field of diabetes, public health, health promotion, health information systems, health planning, health research, NCDs, and wellness. Dr. Cornelius is a founding member of the National Diabetes Center and National Diabetes Foundation, as well as the National Center for Health Promotion and the National Health Promotion Council. Dr. Cornelius has also served in technical and national advisory roles for AusAID and for AusAID funded programs for 6 years. And she is currently promoting wellness through lifestyle changes and is a short-term advisor on NCDs for the Foundation of Rural Integrated Enterprises and Development, Fiji, also known as FRIEND. Ladies and gentlemen, welcome Dr. Cornelius.
Thank you very much, Dr. Lipate, and welcome to everyone. Thank you for being here. I just want to add a little bit more to what Dr. Lipate has said in my introduction. I like to say I am retired, but I'm working on wellness. I've been using a more lifestyle medicine approach, and this session is about some of my perspectives on plant-based nutrition in the Pacific. I live in Fiji and have worked extensively in the South Pacific region as well. To outline what I will talk about, first I will address the overwhelming evidence for the need to be plant-based, including experts and advocates. Next, I will look at the current Pacific NCD crisis, the non-communicable disease crisis in the South Pacific, as Dr. Pate has said. Then I will cover some specific challenges in the Pacific regarding going plant-based. Returning to the West, I will highlight some aspects of the Western way forward as far as plant-based lifestyle and plant-based medicine is concerned. Then I will describe the Pacific way forward, what we are doing locally and regionally, and what we can do maybe regionally and locally. And in conclusion, I will include behavior change, which I think is the most important cornerstone of any lifestyle change that we want to promote. So looking at the evidence, we'll look at next what the evidence are and how I started looking for the evidence. The China study. My daughter is very much interested in the China study as far as plant-based medicine is concerned. So she bought me this book, the report. And this book is written by, of course, the very famous Dr. Colin Campbell. That time, when I received the book, I was eating meat. And I was of the opinion, that myth about protein and meat and milk. So I read the book. I just read the section on diabetes because I was very much interested in diabetes. And then I put it aside and I said, okay, it's there. So let me see what I can do. Then it triggered my interest. Why has this study not been published or publicized for that matter? Then I started looking at some of the documentaries. Forks Over Knives is a good documentary and it's easily found on the net. And there were testimonials of people benefiting from a plant-based diet. Being a physician and having this protein myth, I was still thinking, what's happening with the physicians then? What are we doing about it? It was hard for me to embrace it at that time. So I started looking for real scientific evidence, being a physician, coming from a scientific background. So I said, okay, where shall I look? The Heart Foundation. So the American Heart Foundation was the very first one that I looked at. It said, yes, a lot of conditions, heart conditions, can be reversed or controlled better with plant-based diet. I said, okay, that's one area that there's some of the physicians, some of the clinicians are looking at, and they're looking at plant-based medicine. Okay, go ahead, go forward. I needed more evidence to convince myself, so I reread the China study and really looked at the links. This is before we go to the other need. So I looked at the, going back to the slide, please, Pate. Looking at the China study again, and then also checked out the EAT Commission. The EAT Commission, it's called the Lancet Commissions, and one of the commissions was on the EAT Commission, which looked at food in the Anthropocene. And the issue that they addressed was the Lancet's Commission on Healthy Diet for Sustainable Food Systems. And it was published in January 2016. The issue that was identified was that unhealthy diets pose a greater risk to morbidity and mortality, which is sickness and death, than does unsafe sex and alcohol, drug, and tobacco use all combined. Wow, absence of scientific targets for achieving healthy diets from sustainable food systems has been hindering the large-scale and coordinated efforts to transform the global food system. So the commission brought together 19 commissioners, 18 authors from 16 different countries in various fields of human health, agriculture, political sciences, and environmental sustainability to develop a global scientific target or targets based on the best available evidence and healthy diets and sustainable food production. Well, that's a mouthful. Anyway, it's a 46-page report, and I will challenge all those with a scientific brain like mine to go ahead and read it. So what was the outcome from that for me? The conclusion that I came through while looking at the EAT Commission's paper was our universal healthy reference diet largely consists of vegetables, fruits, whole grain, legumes, nuts, and unsaturated oils, including a low to moderate amount of seafood and poultry, and also includes no or a low quantity of red meat, processed meat, added sugar, refined grains, and starchy vegetables. Wow, that was overwhelming evidence. So now I looked at the next slide of physicians who are actually using this. So the next slide will show the number of physicians who actually are experts and champions using plant-based diets. Some of the top plant-based diet doctors and experts. I looked at the first doctor on there is Dr. Cardwell. Sorry, Dr. Oh, what was his name? Dr. Colin. Dr. Colin is Colin Campbell. He is the father of the whole food. Sorry, Colin Campbell, father of whole food plant-based nutrition, author of more than 300 research papers, and he is the great guy who introduced the phrase whole food plant-based nutrition. He also co-authored the China study. The next gentleman is Dr. Caldwell Iseltin, author of Prevent and Reverse Heart Disease, gold medalist at an Olympic game in 1956, surgeon by profession, and he is promoting plant-based diet to prevent and reverse heart disease. Dr. Neil Barnard, professor of medicine, a very well-known professor of medicine in George Washington University School of Medicine and Health Sciences. President of Physicians Committee for Responsible Medicine. That's another group I looked at and I was very impressed. He's the founder of the Barnard Medical Center, nutrition researcher, author, and health advocate. He is an author of more than 70 scientific publications and 18 books, especially the USA Today bestseller of Barnard's program for reversing diabetes. Wow. Dr. John Dougal, physician and nutritionist expert who teaches better health through vegetarian cuisine. He has been studying, writing, and speaking out with the effects of nutrition as, as a disease for over 30 years. The effect of nutrition on diseases for over 30 years. He with the wife is a co-author for the book called The Starch Solution. The other gentleman is Dr. Dean Ornish, American physician and researcher, president and founder of the nonprofit called Preventive Medicine Research Institute in Sausalito, California, USA. Clinical professor of medicine in the University of California, San Francisco. Author of Dr. Dean Ornish's program for reversing heart disease and Eat More, Weigh Less, and The Spectrum. Well-known advocate for using diet and lifestyle changes to treat and prevent heart diseases. After 16 years of review, Medicare agreed to provide coverage for Dr. Dean Onish's program for reversing heart disease. First time for Medicare to have covered a program on comprehensive lifestyle changes. Dr. Pam Popper, founder and president of Wellness Forum Health, member of the Physician Steering Committee and President's Board for PCRM, which is also Physicians Committee for Responsible Medicine in Washington, D.C. Also, Dr. Michael Greger, FACLM, he's a fellow of the American College of Lifestyle Medicine and is also a founding member, contributes nutrition work on nutritiononfacts.org. This was an overwhelming evidence for me to say that yes, we should be looking at plant-based medicine as doctors as well, and not only other people. So shall we look at the next slide and see what is the problem, what is the burden of non-communicable diseases in our society. Pate, we'll look at the next slide. Dr. Pate. Oh, before we go on to that, let's look at activism. Activism, these are non-medical people. These are celebrities who understand the urgency of doing something to reverse or control non-communicable diseases. James Cameron is a famous filmmaker. I think we all know about the Terminator, the Titanic, and the Avatar. He's an environmentalist, explorer, philanthropist, he does public promotion of veganism, and the whole family is vegan. One of his remarks that's very, very famous was, "Stop eating animals. This is the best thing any individual can do to fight climate change." Cameron and the wife featured in Eating You Alive, which is a 2016 American documentary. His movie, The Game Changers, showcasing vegan athletes and other icons. In June 2019, just this year, Cameron announced a joint venture with a fellow movie director, Peter Jackson, to produce plant-based meat, cheese, and dairy products in New Zealand. So this will help people who love meat transition into a plant-based diet. Also looking at Leonardo DiCaprio, film actor, producer, environmentalist, Academy and Golden Globe Award winner. In 1998, he established a non-profit called Leonardo DiCaprio Foundation, devoted to promoting environmental awareness. He is a vegetarian and rumored to be a vegan as well. Supported the famous documentary Cowspiracy about the impact of animal agriculture on the environment. Recently on Facebook, Leonardo is promoting beefless meals. If he can see the benefit of a plant-based diet, I think we should, as physicians and clinicians and well-wishers and wellness promoters, also look at that. Now maybe we can look at the burden of NCDs or non-communicable diseases in the Pacific. We all know that the rate of diabetes, hypertension, heart diseases, strokes, cardiovascular diseases in a medical term, diabetes, cancers, and chronic respiratory diseases are the 4 major killers in the South Pacific region. This slide only looks at the risk of premature death from any of these 4 major NCDs. If you look at Papua New Guinea is leading the charge with up to 37% higher risk of premature death. That means people are dying too young. They're not even reaching their retirement age, which in the Pacific is only about, 55. Fiji is not far behind, 32%. Kiribati and FSM, Solomon Islands, these are all above 20-25% increased risk of premature death. Our people are dying too young. And these are all largely attributed to the 4 main non-communicable diseases: cardiovascular diseases, diabetes, cancers, and chronic respiratory diseases. So look at the next slide. What can we do? What are our challenges in the Pacific? I think we all know the challenges in the Pacific. And most of the countries, I guess the challenges are the same worldwide, even in the Western world. But our challenges are a little bit more localized. We are using a lot of processed, packaged, and fast foods. Convenient, affordable, easy to get, cheap to buy, not very expensive, and available in every store, no matter how rural the store might be. Also, fashionable to eat processed and packaged food. So these are some of the challenges we are facing. There is a gentleman, a researcher from University of South Pacific, who is currently presenting his initial results. This is Williamo ISA. Some of you might know, Dr. Pate might know. He has presented his initial papers on study that he's doing in Fiji and some of the Pacific Island countries. He presented the Fiji data that people are buying up to 90 to 98% of the food is bought in the store, in the supermarket. And he also studied what they eat at home, the diversity, what are the variety of foods we eat. The variety of foods we eat is very, very low. So this is some of the challenges. If we look at another challenge on the next slide, but the next slide, please. Advertising, social influence, strong social norms, and peer pressure, and the association of lifestyle with unhealthy foods and drinks. Also includes alcohol. Alcohol is also part of the, I think, problem in most of the Pacific Island countries. And the way it is advertised to the younger generation, you know, having a good lifestyle by drinking all these fizzy drinks, sugar-loaded drinks, and other drinks that are so-called healthy but are not healthy. They're supposed to be fruit drinks, but there's more sugar and preservative and flavor in it than actually goodness. So these are other big challenges that we face in the South Pacific and maybe in the Western world too, but we're focusing a little bit on the South Pacific from now. Let's look at the next slide and see what are some of the ways that we can address these challenges. Okay, next slide, please. Oh, before we go into the how we move forward, some myths and cultures we need to discuss. Men eat meat. You have to be very masculine, so you have to eat meat. Women eat vegetables. Some of gender stereotyping, cultural norms, traditions. Sometimes our traditions promote meat eating. We give the best meat and best store-bought meat to the people who come and visit us. Our Pacific culture is very much associated with food. We love feeding people. We like giving food to people when they come, and we like saying, please have some more, please have some more. So these are some of the cultures and norms and traditions that we also have to address when we are addressing a plant-based diet or nutritious foods. Let's now look at how some other places, some other countries are moving forward. The Western way forward, people are promoting meatless Mondays, or try vegan this month, or cutting down on your meat for the various meals. Instead of having 2 or 3 meals with meat or animal-based products, let's cut down to once a day, or maybe once in 2 days. So these are some of the Western way of moving forward. Let's look at what the Pacific is doing, whether there is any movement yet. Let's see in the next slide. The Western way forward. Oh, before we go into the Pacific, the Western way forward is creating plant-based meats for meat lovers. We said earlier, it's a transition. People love their meat. So how can they transition from meat into a plant-based diet? So these are some of the ways in which certain Western companies are now trying to produce plant-based meats or alternatives, or plant-based cheese. People love cheese, they love pizzas, they love the burgers. So how can they transition from meat-based meals to plant-based meats for meat lovers and other people who are in transition? The will may be there, but the availability is also important, and making this available. At the moment in the Pacific, I think we are not seeing this yet, but this is one way for transitioning people who want to go plant-based but are having difficulty leaving the meat addiction. Let's see the next slide, Patin. The Pacific way forward. Dr. Takeosa Mainiwalala is one of the local physicians, very committed, very renowned. He's practiced for many, many years. And he is now studying and using whole food plant-based meals to reverse diabetes in people in Fiji. He has a number of cases that he has written up. It's just waiting to be published. And he presented the initial data in one of the symposiums in the West a week ago. It can be reversed. Like we said, the renowned physicians in the Western world are doing it. And we are getting people who are giving their testimonies to say that it is happening. And here is a local physician who has been trying it, and he has got evidence, he's got data that he is waiting to publish, and he's presenting it that it can be used to reverse or control non-communicable diseases in the Pacific. Let's look at some other ways forward. Local way forward, local plant-based recipes. It is so important for us to make our food more flavorful and more edible. We think we know, we love our food, but now that we are transitioning into food that is store-bought, how can we make local foods just as interesting, flavorful, and nutritious as what we consider the food that we buy from the stores? So we need recipes, and the Foundation for Rural and Enterprises and Rural Integrated Enterprises and Development, where I'm doing a consultancy, also promotes local foods with local recipes and local ways of cooking food that is much healthier than some of the ways in which we cook food. If we look at food that we buy, takeaways and other foods that we buy from the shops or takeaway shops, they are fish and chips, chicken and chips, deep fried food that we eat. So what are some of the things that we can make ourselves that taste similar but does not have all these unhealthy fat and oils that they use again and again for cooking these foods? So it's very, very important. Other initiatives in Fiji that I know of is that there's a vegan potluck movement. There are some vegan restaurants, and there are some other restaurants which have vegan options now, which was unheard of in 10 years ago. And sometimes when you do ask some of the restaurants to prepare your vegan meal, the chef comes out and talks to you, which I think is very, very encouraging, because at least they are aware that there is a need and that are people who would support plant-based meals. So these are some of the initiatives that we have already. And I think that is absolutely wonderful. We need to share more recipes locally that makes the food look interesting and flavorful. Next slide, please. So the Pacific way forward, I'm thinking behavior change is so important. But once we decide that we need to make a change towards plant-based whole food meals, make a decision depending on what is the greatest need. So for example, when I talk to my people who have diabetes, I tell them, your greatest need is to control your sugar. So if you need to control your sugar, you make a decision that I will stop taking sugar in my tea, coffee, or any food that has sugar. So choose one step at a time. It is overwhelming when you have to change your diet and you don't know where to start, because many people have been there, and if we understand this, then it is easier for us to start them in a way that they can identify with, or anyone can identify with. If there is a cholesterol problem, or if there is a hypertension problem where we are saying cut down on your salt and your fat, then that's probably where people can start to replace beef with beans, or to replace chicken with legumes, or to replace salt with lemon juice, or any of these other seasonings. Because the Pacific culture is we take a lot of salt. In Fiji, I definitely know that we have a love for salt because it gives us flavor. And I'm seeing this in the communities when I visit these days as well, to confirm that, we use salt for flavor. So we replace that salt with another dip and make it local. How can we make a local dip that tastes nice and is not salt? So these are some of the issues we look at. Also, mastering it. Once we have done it, like when I stopped sugar in my tea and coffee, I mastered that art first before I went to the next one, which was leaving dairy and all dairy products. So if you feel you've done it, you feel a sense of achievement, and then you go on to the next one. So move to the next step, and we keep going. And this is how we can change our behavior slowly, where it's sustainable. Most of the times, when people go on crash diets, they feel deprived, and after a very short time, they go back to square one, and the end result is worse than when we started. So doing one step at a time, mastering it, then moving on to the next step, and then keep going until we attain either whatever goal we have, whatever wellness goals we have. If we have a wellness goal of losing weight to a certain degree or certain amount, then that's one goal. If we have a goal of controlling our blood sugar and blood pressure, then that's where we want to be. So monitoring the progress and keep going until we get there. Sometimes we need help, and this is why we said earlier that some doctors treat diabetes and hypertension with drugs only. It cannot be treated with drugs only. In my opinion, if it's a lifestyle disease, it needs to be treated with a lifestyle intervention. And being plant-based has been proven to control and manage most of the NCDs that is killing us prematurely. So this, in my opinion, is the way forward in attaining our goal. And the next slide will tell you what our goal is. Thank you for the next slide. The goal is plant-based as possible and one step at a time. So I'll conclude there, and I'm seeing some questions coming up. Thank you.
Thank you again, Dr. Cornelius. Let's just have a look if anybody has any questions, feel free to place it in the chat. Otherwise, just to summarize, thank you, Dr. Cornelius. So the evidence really is there, even though it can be a bit of a painful pill to swallow, and many of us physicians are guilty of maybe turning a blind eye to the overwhelming evidence about how lifestyle change and particularly nutrition. That's one of the painful discussions that we need to have more and more often. Trying to be as plant-based, whole food, eaters as much as possible. But thank you again, Dr. Cornelius, for your time and for presenting on the Fiji story and just some of those gems that we could use to live a healthier life and to combat non-communicable diseases. So if there are no questions, once again, we'd like to thank you all for this. Sorry, there is a question. This question, the person is saying, can you say more about what got you interested in plant-based diets personally and professionally, especially since doctors don't get much nutrition education? Dr. Cornelius?
That's a very good question, because when we trained, nutrition was the last session that anyone would go to. It was not given the importance that it needed, and many of us really didn't know much about plant-based or even just good nutrition. What to eat, how much to eat, what has got the micronutrients, etc. We thought it was just, something not so important, because we wanted to learn about what drugs to prescribe, what conditions we need what drugs, the emphasis was on medical treatment, which is drug treatment of any condition. But as we said earlier, this is a lifestyle issue. Non-communicable diseases are lifestyle-related sicknesses. So we had to look at the lifestyle. And once we started looking at the evidence, I found when I was at the diabetes center that many people came and they could not control their blood sugars, and we kept increasing the tablets. That did not help. So asking them questions about diet, and we asked them, so what do you take sugar in your tea? Yes, they still take sugar in your tea. So how do you expect to control your blood sugars if you're still taking sugar? That was a question that bugged me as a physician. That if we are saying, and they say, oh, but if I don't take sugar, I feel very weak. It was just probably more mental, probably what
Yeah.
people thought in their mind, that if I don't take sugar, I'll feel weak. Then I started researching then, that was about 10, 15 years back, and looking at the need for good nutrition to control this disease. And I found that once we started talking about good nutrition, it was helping patients control their diabetes. And then we wrote a book, actually, a 44-page book, way back in 1988, to talk about nutrition. And that was helping people control their diets. Also, when we looked at high blood pressure and other heart diseases and the cholesterol stories, we knew that it had to have a say in it. We know through some researches done in Fiji that the salt intake in Fiji is very high, that anemia rates are very high. We were only talking about cardiovascular diseases, but if we look at anemia, so people are not eating the right food because we are so blessed with so many green leafy vegetables. So why, even if we're not eating meat may have been expensive, or people could not afford for any reason. Even if we're not eating meat, we are eating meat, and yet we are anemic. So these are issues that kept creeping up, and we said, look at what is causing this. And then we looked at the diet, and we looked at the way the food is prepared and all these issues, and we know that we can tackle this problem with a plant-based diet. Cutting down on meat to at least 5% of your total food intake will help with the cholesterol as well, will also help with the rates of cancers we are having. And there's a lot of additives in the prepared meat, the processed meats. We know that now, and there's some things added in the meat to keep it fresh. We know that there are chemicals added, and we can reduce our cancer rates and our other non-communicable diseases by avoiding or cutting down meat to as little as 5%. So my interest started when I was working with diabetes, and then when I started working with other non-communicable diseases, I found that if we didn't look at the nutrition side together with exercise and stress relief and all the other environmental factors, then we were not doing justice to people we were treating for any of the non-communicable diseases.
Mm. Okay, thank you for that, Dr. Cornelius. Dr. Cornelius, since you were talking about meat, another question has come in asking about the protein, let's say, myth. You know how when we were growing up, and it's a common misunderstanding that the public thinks, that's still in the public when it comes to meat. So they think, oh, if you don't have our meat, where are we going to get our protein? You care to weigh in on that?
I think the protein myth, yes, I should actually talk about the protein myth, because when I trained, I was still very much believing in the protein myth that protein comes from meat and dairy. And I strongly believe that. But if you look at the analysis now of grains and vegetables, and there are many varieties of vegetables, and they have a lot of micronutrients as well as protein. So the protein myth was a very hard one for me to let go because of I think it was, they say your mind gets very conditioned because of what we are taught when we were even young. So my mind was conditioned into thinking that if I don't eat meat, uh, I will not have enough protein. My daughter became vegetarian when she was 16 years old, and I nearly had a heart attack because I said, what am I going to feed her? She was still living with me at home. And I just said, if you don't eat meat, what am I going to feed you for protein? And that's another reason why I started looking deeply into where are the proteins coming from. There are more than enough proteins coming from all the grains and green leafy vegetables and other vegetables that we have. And this is one of the other reasons when it became personal, I had to really delve into it and look at what are the sources of protein. And now more and more people are becoming vegetarians and vegans, and they are surviving. So where are they getting their protein from? I know that many people are saying that there's not enough nutritionists around the place, to counsel people or patients. But most of the information is now available. Dr. Google is our good friend now. Sometimes there's confusion, then we need to ask a nutritionist or a physician, a responsible physician who promotes plant-based diet. But otherwise, there's more than enough information out there for people to look at and find for themselves. Dr. Lipate also wanted to mention the CHIP program. I think that's a very good program. Would you like to elaborate a little bit? I also wanted to mention Ilatia Tuimua and his testimony, how he reversed his condition by just going plant-based.
Yeah, I think we'll probably need to do another webinar to really give that justice. But basically, in summary, CHIP is a program. It's a lifestyle education, empowerment, intervention program that's allowed over 80,000 people around the world to take back control of their health, and it's been proven in many instances
Absolutely.
to reverse and treat chronic diseases. Dr. Cornelius, there's another interesting question coming from one of our listeners, and this one is particularly pointed. So the question refers to what we were discussing a little bit earlier about the capacity building for health professionals, and how we would, or how would you suggest trying to change the thinking of health professionals in particular to be able to direct patients to a more healthy diet?
It's a very, very good question and a very interesting one, because when we started being medical students way back 30, 40 years, nutrition was not a big part of it. Now, I think the more and more physicians are realizing, and I'm not quite sure what the medical schools are doing. I know that in the Western countries, nutrition is now a major part of the medical students' education. But in the Pacific, I am not too sure. So that's one thing that I think the Society for Lifestyle Medicine in the Pacific will be looking into, to see whether there is a larger portion of education on nutrition for the medical students. Since lifestyle diseases are the major killers, we need to put more emphasis on those. In the Pacific, some of the places we have a double burden, communicable as well as non-communicable diseases, but definitely the figures are showing that lifestyle diseases are the major killers. So if there is a lifestyle problem, then the solution should involve lifestyle changes. So we will be looking at, hopefully we will be looking at how we can weave that into medical school curriculums in the Pacific. I know that in schools, they are talking about nutrition. And I think maybe the education system is much more advanced than the medical system. I'm not sure. We have to have a look. We have to see that lifestyle changes are included in a big way in the modern doctors that are graduating. And I think they are coming out into the community and looking at what is the burden in the community. So they are getting sensitized to it. And while they are in the community, looking at the conditions or doing their community attachments, that's a good place to start. And we have been talking to these physicians, the trainee physicians, when they were coming to the Diabetes Center or the National Center for Health Promotion for attachments. that lifestyle diseases need a lifestyle solution, and nutrition is one of the biggest cornerstones. I hope that answers the question a little.
Yeah, I think it's all about education, trying to educate health professionals. But you're right. It'll be interesting to see if we start younger with our children. And I think looking at yeah, we probably just need to work with the Ministry of Education to get rid of some of these myths that we were talking about today in this
Absolutely.
presentation. Some people have mentioned the fact that they enter a program and it becomes difficult to stick with it. And that's probably where we need to start creating a culture where, like you said, healthy eating and a healthy lifestyle becomes more and more socially accepted. And it really does need to start with all of us. Anyway, ladies and gentlemen, thank
Yes.
you again for your questions, and thank you to Dr. Cornelius for your very enthusiastic presentation. So we're just going to start wrapping up. Once again, ladies and gentlemen, if you haven't signed up to the South Pacific Society of Lifestyle Medicine, please do so at www.spslm.org, and you can follow us on Facebook, Twitter, Instagram, and LinkedIn. And don't forget the conference, which is going to be in March 2020. And if you want to get board certification, you know where to find us. If you forget everything I just said, take out your smartphones, take photos of the QR codes. It'll direct you to the SPSLM website or the SPSLM Facebook page. Dr. Cornelius, once again, on behalf of the SPSLM team, thank you very much and have an awesome night. And we look forward to working with you into the future in promoting lifestyle medicine.
Thank you.
And to everybody else, good night. We had a lot.